The heart-mind connection. How emotions shape cardiovascular health. When we think of heart health, most people picture cholesterol levels, blood pressure readings, and aerobic exercise. But the truth is, the heart is more than just a pump. It's an energetic and emotional center that responds just as powerfully to thoughts and feelings as it does to diet and physical activity. The connection between the heart and mind is profound, and modern science is beginning to catch up to what ancient healing systems have known for centuries. Our emotional health is directly tied to our cardiovascular well-being. The science behind the heart-mind connection. The heart and brain communicate constantly through a complex network of neural, hormonal, and energetic pathways. The autonomic nervous system plays a central role in this interaction. It has two main branches: the sympathetic, fight or flight, and the parasympathetic, rest and digest. Chronic stress, anxiety, and unresolved trauma can overactivate the sympathetic system, keeping the body in a constant state of alert and pushing the heart to work harder than it should. This ongoing stress response increases heart rate, raises blood pressure, and promotes inflammation throughout the cardiovascular system. Over time, this can lead to conditions like hypertension, arrhythmia, and atherosclerosis. Conversely, positive emotions like gratitude, love, and compassion activate the parasympathetic system, helping to lower stress hormones and bring the body back into balance. Heart rate variability. A window into emotional health. One of the most fascinating tools for measuring the heart-mind connection is heart rate variability, HRV. HRV is the variation in time between each heartbeat, and it reflects the adaptability of your autonomic nervous system. A higher HRV indicates greater resilience and a more balanced nervous system, while a low HRV is associated with stress, fatigue, and increased risk of heart disease. Practices like mindfulness meditation, deep breathing, and biofeedback have been shown to improve HRV, reduce anxiety, and support heart health. Organizations like the HeartMath Institute have conducted extensive research showing that cultivating positive emotions can create coherence between the heart and brain, improving overall well-being. Emotional patterns that affect the heart. Certain emotional states are especially harmful to the heart when left unaddressed. These include chronic stress, elevates cortisol and adrenaline, straining the heart. Depression, associated with increased inflammation and risk of heart disease. Anger and hostility can cause spikes in blood pressure and increase cardiac events. Loneliness, linked to a higher risk of heart disease and stroke. On the flip side, emotional healing and connection can be profoundly protective. Feeling loved, supported, and connected to others has been shown to reduce cardiovascular risk and improve recovery after heart-related events. Healing the heart through emotional wellness. Supporting cardiovascular health through emotional well-being isn't just possible, it's essential. Here are several holistic practices that can help harmonize the heart and mind. Mindfulness and meditation helps calm the nervous system, reduce stress hormones, and create emotional clarity. Expressive writing. Journaling about difficult emotions has been shown to reduce physical symptoms of stress. Therapy and counseling, working through unresolved trauma and emotional pain, supports overall heart health. Gratitude practice. Daily expressions of gratitude can improve mood and lower blood pressure. Heart-centered breathing, a technique used to create coherence between heart rhythms and brain waves. Connection and community. Spending time with loved ones and feeling socially supported has real physiological benefits.